I remember the day clear as a bell. I was on vacation in Florida in April 2007 with my family, and I had a shooting pain so severe that I grabbed my left breast. I realized at that point that there was a lump, a pretty sizable lump that had never been there before. I made every excuse at the time for why this lump was there. I was working a fast-paced corporate career. I had two children then, ages 9 and 6, a husband, and my elderly parents were living with me. So needless to say, my health got put on a very back burner because time off from work was often used for my parents or for my children, and I very rarely took a time out to take care of me. July of 2007, I was surprised to realize that I was indeed pregnant. I was floored, and of course I made an appointment with a new doctor right away to, confirm the pregnancy. And finally at this appointment, it was when I asked her to address this lump that had now been in my breast for several months and had not gone away. Imagine my shock. 24 hours later, I was at work and Dr. Quinlan called me and said that my results from my initial fine needle biopsy were suspicious. The following Friday, 7 o'clock at night, Dr. Quinlan called me to tell me that I had stage 2 cancer. I had a triple negative subtype of breast cancer, a very aggressive form, and I needed to be seen immediately and start treatment immediately, even despite the fact that I was 14 weeks pregnant. I went into UMass Memorial the following week and spent an entire day on the campus meeting with all the specialists. I had some reservations because where I live in central Massachusetts, Boston is known to have some of the greatest cancer centers in the world. So my immediate knee-jerk reaction was like, I'm going to Boston. I'll go to one of the other cancer centers because why not? I'm pregnant, I need help. After meeting with UMass Memorial's doctors all day long, at the end of the day, I realized this is where I needed to be. I had instantly formed a bond with the oncologist right away, and I knew that these people were going to be the ones to save my life and that of my unborn child's life. With a huge leap of faith, I jumped off the cliff and trusted that my life and my unborn daughter's life would be saved by these special people. I delivered Reese 5 weeks early. They induced me so that I could continue and get on the other chemotherapy that I couldn't have while I was pregnant. So that was a highlight in my dark days, was giving birth to a perfectly healthy baby who did not glow in the dark from the chemotherapy. I was given more chemotherapy, and I was giving radiation treatment, and then I was deemed clear with no evidence of disease. My name is Rebecca Soulliere, and I am a cancer survivor.